Welcome to the Bloodborne Pathogen and Infection Control First Quarter Safety Training, presented by Matthews HR and Safety Consulting Services. This training is designed to help you keep yourself and those around you safe from exposure to bloodborne pathogens. Specifically, it covers the basic of bloodborne pathogens, how to protect yourself, and what to do in the event of an exposure, including the decontamination process. After completing this training, you will be able to explain what a bloodborne pathogen is and how they are spread, describe what measures can be taken to help protect against exposures to harmful bloodborne pathogens, discuss how to respond to emergencies involving bloodborne pathogens, recognize what to do in the event you are exposed to another person's blood or other potentially infectious material. And since infection is one of the leading causes of preventable deaths in the healthcare every year, the Centers for Disease Control and Prevention estimate that there are approximately 2 million preventable infections every year, leading to 90,000 unnecessary deaths. So we'll cover those specific microorganisms and what you should do to effectively help prevent the spread of infection. It's important to first tell you about OSHA. OSHA is the Occupational Safety and Health Administration. They're a division of the Department of Labor put in place to protect American workers from harmful exposures, bloodborne pathogens being one of those. They require employers to provide a safe working environment, and they have developed occupational exposures to bloodborne pathogen standards that employers and employees alike must follow. So OSHA's bloodborne pathogen standard is intended to protect employees against pathogenic microorganisms that are present in human blood and can cause disease in humans, including hepatitis B, hepatitis C, and human immunodeficiency virus. Employees that work in direct patient care, maintenance, housekeeping, waste disposal, and laundry services are at the highest level of potential exposure to blood or other potentially infectious material as a result of their job duties. Therefore, OSHA requires employers with employees that have an occupational exposure to be properly trained and be provided protection from bloodborne pathogens. Even if you do not have a job within occupational exposure, it is a good idea to understand the dangers associated with bloodborne pathogens and discover ways to protect yourself. The standard requires employers to establish an exposure control plan, update that plan annually, implement the use of universal precautions, identify and use engineering controls, identify and ensure the use of work practice controls, provide personal protective equipment such as gloves, gowns, eye protection, and masks. Make hepatitis B vaccinations available to all workers with an occupational exposure. And make available post-exposure evaluation and follow-up care in the event a worker is exposed. Use labels and signs to communicate hazards while still maintaining HIPAA. Provide information and training to workers, and maintain worker medical and training records. As previously mentioned, part of the plan is to ensure we define who is at risk. Direct patient care, housekeeping, laundry services, maintenance are those that we typically think about in our setting. However, sometimes food service can also be exposed, and it's not a normal thought that we would have, but if they're delivering meals to patient rooms, they would be exposed. And so we want to make sure we're always defining who's at risk, outlining procedures, that everyone's getting trained properly on what signs mean what type of personal protective equipment needs to be worn, and whenever new or modified tasks or procedures affect occupational exposures, that those are added to the plan and trained to the staff. The CDC estimates that 5.6 million workers in the healthcare industry and related occupations are at risk of occupational exposure to bloodborne pathogens, including HIV, hepatitis B, hepatitis C, and others. All occupational exposure to blood or other potentially infectious material place workers at risk for infections with bloodborne pathogens. It is important that you realize that while there are other potentially infectious materials, including vaginal secretions and saliva and dental procedures, unless visually contaminated with blood or OPIM, bloodborne pathogens do not include vomit, urine, feces, sweat, tears, and spit. Again, spit outside of dental procedures. This slide demonstrates other BBP examples, including those passed from an animal to a human. The hepatitis B virus has a non-immune healthcare personnel with a 6 to 30% chance of getting the hepatitis B after a critical exposure. Blood contains the highest concentration of hepatitis B, 100 times more than HIV, and there is a series of vaccines available that are provided for free through the employer. You cannot get hepatitis B from the vaccine, and the vaccine is usually given as a series of shots over time. Did you know that hepatitis B can actually survive in dried blood up to 7 days? Some of these symptoms include fatigue, loss of appetite, nausea, jaundice, fever, abdominal pain, joint pain, and 30% have no symptoms at all. This is one virus that is preventable from passing from person to person by following standard precautions and wearing protective equipment. Hepatitis C is the most common chronic bloodborne infection in the U.S. It causes liver damage, cirrhosis, and liver cancer. It's the leading reason for liver transplants. 2% of infection is by contaminated sharps, and it may occur within 2 weeks to many years after infection. 85% of the population do not know that they are infected. There is no vaccine for prevention at this time. Treatment is available after infection and has a 95% cure rate. There are 50,000 needle sticks annually related to hepatitis C infection. It is important to know when it comes to safe needles operation, you never want to recap a needle. Most are having a automatic retraction with the needles now, or you're simply putting it in a bloodborne pathogens red bin. There is no evidence from transmission from environmental blood exposure. The human immunodeficiency virus, known as HIV, attacks the body's immune system, making it unable to fight off other infections. At the time of this training, there are no vaccines and no cure. 1.2 million people in the U.S. are living with an HIV infection, and almost 1 in 8 are unaware of their infection. The CDC reports 50,000 new cases per year of HIV. The symptoms start off as mild flu-like initially with a fever and swollen glands. However, people may be free of symptoms for months and many years. HIV may lead to AIDS and death. There is a high risk for HIV coming from sexual activity and IV drug abuse. There's also neonatal transmission and accidental occupational exposure. Exposure to HIV-infected blood and body fluids usually are going to be from one of the following: a dirty needle or sharp, and that accounts for about 3 in every 1,000 cases. mucous membrane splashes, and that's 1 in every 1,000 cases. Non-intact skin, again, that's 1 in 1,000 cases. And prompt antiviral treatment after exposure can reduce the risk of infection by 60 to 80%. The outside window for giving post-exposure medication is 72 hours. So please make sure if you have an exposure that you are reporting it early, as the viral medications are best given within 2 hours of the exposure. It is estimated that 600,000 to 800,000 needle stick injuries occur each year in the United States. Contaminated sharps means any contaminated object that can penetrate the skin, including, but not limited to, needles, scalpels, broken glass, broken capillary tubes, and exposed end of dental wires. OSHA's bloodborne pathogen standard, 29 CFR 1910.1030, as amended pursuant to the Needle Stick Safety and Prevention Act of 2000, prescribes safeguards to protect workers against the health hazards caused by bloodborne pathogens. Its requirements address items such as exposure control plans, universal precautions, engineering and work practice controls, personal protective equipment, housekeeping, laboratories, hepatitis B vaccination, post-exposure follow-up, hazard communication and training, and record keeping. The standard places requirements on employers whose workers can be reasonably anticipated to contact blood or other potentially infectious material, such as unfixed human tissues and certain body fluids. The Needle Stick Safety and Prevention Act, also known as the Act, was signed into law on November 6, 2000, because occupational exposure to bloodborne pathogens from accidental sharp injuries in healthcare and other occupational settings continue to be a serious problem. Congress required modification of OSHA's bloodborne pathogen standard to set forth in greater detail and make more specific OSHA's requirements for employers to identify, evaluate, and implement safer medical devices such as needleless systems and sharps with engineered sharp protections. The Act also mandated additional requirements for maintaining a sharps injury log and the involvement of non-managerial healthcare workers in identifying, evaluating, and choosing effective engineering and work practice controls. These are workers who are responsible for direct patient care and be potentially exposed to injuries from contaminated sharps. The Act directed OSHA to revise its bloodborne pathogen standard, and OSHA published the revised standard in the Federal Register on January 18, 2001. It took effect on April 18, 2001, and the requirement to implement the use of engineering controls, which includes safer medical devices, has been in effect since 1992. With tens of thousands of new cases reported each year in the United States, many of them after exposure in the workplace, anytime you come in contact with another person's blood, or what OSHA calls OPIM, which is the other potentially infectious materials, you're at risk for becoming infected. OPIM includes the body fluids that have come to be associated with transmitting diseases, like semen and vaginal fluids. But even bodily fluids like saliva and vomit and urine are regulated as OPIM if they are visibly contaminated with blood. These pathogens can enter your system when an infected person's blood or OPIM comes in contact with your eyes, mouth, nasal membranes, or other non-intact skin, including pure skin or an open wound. Because you won't know who in your workplace may or may not be a host to bloodborne pathogens, you should treat all blood and OPIM as if it was infectious. This is known as universal precautions. Whether you have occupational exposure or not, universal precautions require you to always assume someone's infectious and protect yourself accordingly. As stated earlier, there are several job duties that one would reasonably expect to have exposure to blood. However, we wanted to list all of them out for you with possible exposures, especially those who have to provide emergency first aid, even if it's not inside the medical setting. You always want to make sure that you are treating everyone's bodily fluids and blood as they could be infected. Engineering controls reduce employee exposure by either removing or isolating the hazard or isolating the worker from exposure. Examples include self-sheathing needles, needleless injection systems, and puncture-resistant disposal containers for contaminated sharps. These controls must be maintained or replaced on a schedule. They also require annual efforts to ensure appropriate technology and medical device sections are made. Control measures are practices and procedures used to help eliminate or minimize contact with blood and OPIM. There are various control measures you may encounter in the workplace. All equipment and environmental and working surfaces shall be cleaned and decontaminated after contact with blood or other potentially infectious materials. Some equipment, if grossly contaminated, must be cleaned with soap and water solution prior to decontamination, as some antimicrobial products will not work in the presence of blood, which interferes with the sterilization process. Protective coverings, such as plastic wrap or aluminum foil, shall be removed and replaced as soon as possible when they become overly contaminated, or at the end of a work shift if they may have become contaminated during the shift. All bins, pails, cans, and similar receptacles intended for reuse, which have been reasonably likelihood for becoming contaminated with blood or other potential infectious material, shall be inspected and decontaminated on a regularly scheduled basis and cleaned and decontaminated immediately or as soon as feasible upon visible contamination. Broken glassware, which may be contaminated, must not be picked up directly with hands. Use mechanical means such as a brush and dustpan, tongs, or forceps. So you may be wondering, what does OSHA currently accept as an appropriate disinfectant to prevent the spread of HIV and hepatitis? A review of the initial intent of the bloodborne pathogen standard that specifically deals with cleaning of contaminated work surfaces reveals that OSHA intended to provide a performance-based provision that would allow for future development of appropriate disinfectant products. OSHA has reviewed the information on the disinfectant and has reconsidered its position on EPA's registered disinfectants that are labeled as effective against hepatitis and HIV. OSHA's current stance is that EPA-registered disinfectants for HIV and hepatitis meet the requirement in the standard and are appropriate disinfectants to clean contaminated surfaces, provided such surfaces have not become contaminated with agents or volumes of concentrations of agents for which higher level disinfecting is recommended. It's important to emphasize the EPA approved label section titled Special Instructions for Cleaning and Decontamination Agents HIV-1 and HBV of surfaces and objects soiled with blood and body fluids. On the label that OSHA has seen, these instructions require personal protective devices for the worker performing the task, that all blood must be cleaned thoroughly before applying the disinfectant, that the disposal of the infectious waste is in accordance with federal, state, and local regulations, and that the surface is left wet with the disinfectant for 30 seconds for HIV and 10 minutes for hepatitis. You want to ensure that you are also thoroughly washing up after you have cleaned and decontaminated work surfaces or after an exposure, and then properly dispose of the contaminated PPEs, towels, and rags in the appropriate bins. So cleaning is specifically defined as removing debris, meaning dirt, bodily fluids, and sticky residue from a surface. And then disinfection It cannot be accomplished without burst cleaning. The disinfection portion is going to eliminate or kill most germs present on surfaces that can cause infection or diseases. The time-dependent process is how long the surface needs to be wet and be allowed to dry. If you recall on the previous slide, one item said 30 seconds and another one said 10 minutes. On each of the different cleaning cloths, you will see there's a specific time frame. The purple and white container of Super Sani Cloth is a 2-minute contact time, and the orange and white Sani Cloth with bleach is a 4-minute contact time. Hospitals must use EPA-approved products for health cares. All equipment and environmental and working surfaces shall be cleaned and decontaminated after any exposure with blood or other potentially infectious material. Some equipment, if grossly contaminated, must be cleaned with soap and water solution prior to decontamination. Protective coverings, such as plastic wrap and aluminum foil, shall be removed and replaced as soon as possible. You also want to make sure that you are cleaning the surfaces between each patient, especially in shared spaces such as a wheelchair, a phone, a logging in system, or an elevator button. You want to make sure that you're protecting yourself from accidental contact with contaminated items by being aware of the symbols and colors used to represent biohazard materials. Biohazard warning labels are fluorescent orange or orange red, and at a minimum include the biohazard symbol and the word biohazard in a contrasting color. OSHA's regulations indicate that the biohazard symbol is not required where red bags or containers are used. Biohazard warning signs or tags are used to identify equipment or areas that are contaminated with blood or OPIM and are still in need of cleaning and disinfecting. For your protection, be sure you read the following instructions on any biohazard warning sign or tag found in your work area. It may have specifically what cleaning product you need to utilize. It may have that it needs to sit under a certain light for a certain amount of time. So please make sure you're reading all of the instructions on any warning sign or tag. Infection control also have standard precautions. They include hand hygiene, use of personal protective equipment, such as gloves, gowns, and face masks, depending on the anticipated exposure, respiratory hygiene and cough etiquette, safe injection practices. There is scientific evidence that hand hygiene helps to prevent the spread of infection. Protect yourself and your patients from potentially deadly germs. Foam is best for killing most germs. Washing with soap and water is necessary if hands are visibly soiled and when you're caring for a patient with certain GI illnesses. The 4 moments of hand hygiene are before contact with a patient or before putting on gloves, before an aseptic task, after body fluid exposure risk, and after patient or equipment contact or removal of gloves. Especially in the last few years, hand sanitizer has become very popular in our work environments. Hand sanitizer is welcome to be used if hands are not visibly soiled. You want to make sure, though, you have enough product to keep your hands moist as you rub the product in your palms throughout all surfaces in between your fingers, the back of your hand, and each thumb. If your hands are soiled, dirty, or contaminated, or if they're starting to feel sticky from too much sanitizer, you definitely want to go ahead and use soap and water. You want to wet your hands with warm water, add soap to the palms, and rub hands together to create a lather. You want to rub your hands together for at least 20 seconds. Whether you're using soap and water or hand sanitizer, the most missed of your hands during hand hygiene is fingertips and thumbs. Be sure to use hand hygiene techniques that clean these important areas as well. You can see based on the colors what are the less frequently missed, more frequently missed, and then the most frequently missed. As mentioned earlier in our training, employers are required to provide most personal protective equipment, also known as PPEs. They include gloves, masks, face shields, safety glasses. In general, employees are responsible for making sure they properly wear the PPEs. They attend training sessions on how to use the PPEs. They care for, clean, and maintain the PPEs properly, and they inform their supervisor of the need to repair or replace the PPE. On this slide, we have some general PPE guidelines that include but are not limited to wearing gloves when handling chemicals or bodily fluids, wearing safety shoes, boots, and covers if hazardous substance is likely to splash, wearing an appropriate gown or coverall if hazardous substance is likely to splash as well. You want to make sure when you're putting your gloves on, you've washed your hands first. Then you put your gloves on and inspect them. Any little microscopic holes or improper fitting could expose you. So you want to make sure that if you see an issue or it's not sitting right, that you remove them and put a new pair on. When you're going to be wearing your eye protection, you want to make sure whether it is a safety glass or a face shield, that it fully covers all sides of your eyes and that it has a nice secure fit around your nose bridge. When it comes to gloves or other personal protective equipment, the guidance suggests for a latex-free product because so many people do have latex allergies. They may have a mild sensitivity and it could progress to life-threatening allergic reaction with continued exposure. Some medical supplies that have latex are adhesive tape, disposable syringes, elastic bandages, wound drains. Other products that you may come in contact with in your workplace are wheelchair tires that have latex, baby pacifiers if you deal with younger people, disposable diapers for both babies and adults. So make sure you're really checking your work environment, and if you are someone who's in charge of ordering, ensure latex-free products as much as possible. So as mentioned earlier, you want to make sure you're watching for the transmission-based precaution signs. Here is an example of some signs used at a hospital. There is orange, that's requiring gown and gloves. There is green, that's requiring a surgical mask. Brown is requiring a gown and gloves as well. As when leaving the room, you also must use soap and water for your hand hygiene, and a bleach product must be used for cleaning the room. And then the blue is providing notification to the staff that they must wear an N95 mask because of the airborne precautions. Contact precautions are used mostly to prevent the spread of MDROs, known as multi-drug resistant organisms, that are spread through contact with the patient or their environment, such as MRSA, VRE, and MDRO. It's also used to prevent the spread of pests such as lice and scabies. As we previously saw, the brown contact precaution sign stated that bleach must be used for cleaning rooms and patient care and equipment. This one is going to be used to prevent the spread of germs that can spread by contact with the patient or their environment, plus require special cleaning to properly kill the germ, such as C. diff, norovirus, rotavirus, and other GI known cases. In some cases, we need to utilize a negative pressure room, where the air in the room is exchanged 12 times per hour versus the 6 per hour in a regular room. To maintain the room at a negative pressure, the doors must remain closed. This is going to protect patients and healthcare professionals from airborne diseases such as chickenpox, shingles, measles, TB, and coronavirus. This will require a special fitted N95 mask for room entry and patient care. With airborne precautions such as TB, the flu, and COVID, it's invisible airborne particles that can be generated when a person sneezes, coughs, speaks, or sings, and that is why the higher protective equipment for respiratory is required. It's important that we all follow cough etiquette, where you're going to be covering your cough or your sneeze. It's been shown that germs can spread 3 to 6 feet or more from a cough or a sneeze. It's important that we are coughing or sneezing into the bend of our elbow to avoid sharing germs. Ideally, you would want to have a tissue or a paper towel as well to cover so that you are not spreading your airborne germs. Please make sure you're teaching your patients the proper cough etiquette. So you play a big important role in protecting yourself and patients. We want to make sure you're following procedures to prevent exposure with safe handling of sharps, standard precautions, wearing personal protective equipment, getting vaccinated for those of you who are able to from hepatitis B and the flu and other options. Report any critical exposures immediately. Use transmission-based precautions. Wear your mask, maintain social distance, clean and disinfect equipment and surfaces, and definitely clean your hands and help save lives. If you have any questions, please contact your supervisor directly or contact your host facility with your questions for their specific policies and procedures. Thank you for attending and have a great rest of your day.